Next, Medical Staff Executive Committee, Chief of Staff, Dr. Kinzie.
I have nothing to present that we need to vote on, just a few comments. At our medical staff meeting, we had a presenter come in to help us understand some of the differences in charting and the billing that we could expect to obtain. There are some crazy rules and requirements about how exactly you list a diagnosis in order to get paid better. And the difference can be, she showed us, $6,000 on a 10-day admission. And it would just, a doctor might think they wrote down perfectly reasonable diagnoses, and in fact they are, but because they don't meet the exact wording that Medicare or Medicaid expect in order to grant you this extra money. So there's going to be a lot of challenge. We can tell already that there are times that because things have been written, haven't met Medicare or Medicaid standards, that we've lost money, it's just gone. And I think that hopefully if we can find a few of the places where we make those biggest errors and help our doctors kind of get those written down, that we should be able to make the amount of money on each admission that we really deserve. It's complicated, and I think it's very hard, especially when we have physicians here who have worked for 35, 40 years and know what the diagnosis is, but they don't know the right words to put down to make sure the hospital gets paid the best for it. So Candace has been working with the billing folks to help us figure that out and try to make it a little bit easier. There's nothing wrong with writing down the diagnosis the way it's supposed to be written, but we need to know what that is, and many of us just don't know those numbers. So I think everybody's willing to work on that. People just don't know how to do it. Second thing is influenza is big this year. Last year it was mild, simple. About 1 in 100 influenza tests were positive. This year it's more like 17% of influenza tests are positive, so there's a lot more flu out there. Influenza is actually an upper respiratory illness, kind of like a pneumonia with high fevers and you feel miserable and all of that. A lot of people think of flu as diarrhea and vomiting. Unfortunately, that's going around too, and a lot of people are getting both at the same time, being sick for weeks and weeks. The flu vaccine, a lot of it was distributed. There's still some left to get, but it is getting in shorter and shorter supply. So I do recommend that people try to get their influenza shot if they can. And another important thing is if people are exposed to influenza, if somebody you know has gotten influenza, we can give Tamiflu, which is a medicine that will help prevent getting the influenza or prevent getting it so badly, but we need to start that within 48 hours of the exposure. And the Tamiflu also will help the flu, but only when given within 48 hours of the initial symptoms. So it's important to get in early for either of those cases. If you know somebody who's debilitated and has been exposed to the flu, they should get in early to their doctor to get the Tamiflu. Dr. Mullins, once again, she's the St. Anthony's cardiologist, kind of saved us today. Had a patient come in who had some heart problems, contacted his cardiologist in Oklahoma City, but he was too busy to see him. Called 2 cardiologists in Enid. They couldn't get a guy in. We called Dr. Mullins and said, please, what can we do? I got a guy here. Don't really want to send him to the emergency room. She's like, okay, do this, and I'll see him on Tuesday. And it was smooth as silk, put all of us at ease. Patient was happy with the solution, happy to change cardiologists.
I would be too.
And it was very nice. I mean, his cardiologist had a good reason not to be able to talk to us, but it hurts when you're having a scary problem and you can't get it taken care of. And then last but not least, wound care. The wound care team that I have is working great. Our wounds are healing up nicely, which creates a small problem. that we need more wounds. So.
Any volunteers?
So we just, you know, a lot of people don't understand what wound care is. They're like, well, you know, I cut myself, it gets better. A lot of people do have wounds, simple wounds like that you cut yourself and they get better. We don't worry about those. What we take care of are chronic wounds that are stuck in healing that aren't getting better the way they're supposed to be. And some people I know are still going to Enid every week or twice a week to get their wounds taken care of. And so we just need to get the word out that we are a wound care center. We are taking great care of wounds. We don't have many left. We were full today, but almost everybody's healed.
That's a problem.
Yeah, it's a big problem. So we just we need people to know that we do take care of wounds here. They do not have to travel to Enid except for really certain complicated things that we can't fix here. But it's all going great.
Good. Well, thank you for your report. And thank you for your service and doing a good job there in the clinic. Thank you.